More now on the developing COVID situation right around the nation. Joining us live is Natasha Robinson, the health editor at the Australian newspaper. Natasha, appreciate your time. A lot of argy-bargy today between the Commonwealth and some state premiers. We are seeing mixed messages, aren't we, when it comes to this vaccine strategy, which I know you wrote about for the Australian today.
Yeah, it's been pretty extraordinary, I think, just seeing the comments from the Chief Health Officer in Queensland this morning, Jeanette Young, talking about very, very strongly coming out and saying that she doesn't want to see anyone aged under the age of 40 get Pfizer, and saying that she doesn't basically want to see anyone die. I think that they were quite extraordinary comments when you look at the actual risk that we're dealing with here. I've just been looking at some of the stats that have been published by the Australian Technical Advisory Group on Immunisation, who tell us that the actual risk of getting one of these rare blood clots if you're aged between 30 and 39 is 1.6 cases in 100,000. But what you've got to remember is that only 3%, the death rate of these clots in Australia is only 3%. So we've had 64 of these cases, mostly in older people, and only 2 deaths, which means that that sort of scenario that's being painted there by Jeanette Young just isn't really a thing in the figures. If you take 1.6 cases in 100,000 shots and then take 3% of that in terms of the death rate, it's really, really tiny. So I think those comments were very inflammatory. And I think we saw New South Wales take a much more measured and sensible position when they said, look, okay, we're not going to give the AstraZeneca shots in our mass vaccination hubs, despite what the Prime Minister has said. We don't think that's appropriate. And they gave their reasons for that, which I think are, very sensible, in that people who are under 40, who do want to get the AstraZeneca vaccine, really should be having that conversation with their GP. And it's a mass vaccination hub just isn't the right forum to have those kinds of conversations that need to take place. So I think New South Wales is taking the sensible position here to saying, even though we're not going to make it available for you in our mass hubs, and we think you should follow the ATAGI advice. ATAGI has never said that there's a ban on young people getting AstraZeneca. They have always said that if somebody sees that the benefit for them in that scenario outweighs the risk and that they want to make that informed choice, then they can.
Yeah, and I think that's an important point, isn't it? The risk analysis that individuals have to take depending on their own circumstances. In response to AstraZeneca now being more widely available for doctors to give with the indemnity issue sorted out, is it too early for us to tell if there is a real demand for younger people to go and get the AstraZeneca? I mean, have we seen young people rushing out to get it in the last couple of days?
Yeah, I think it's really hard to tell at the moment. I mean, I've certainly seen a lot of people on social media posting that they've made an appointment and they're booking in as soon as possible. We've seen other reports saying that some GPs just aren't comfortable recommending to people that they do get it. So I think as time goes on, hopefully the government might keep some statistics on that, although getting to see that level of granular detail in the statistics is probably not going to happen anytime soon, given the stats that are actually available to us. So I guess we'll be relying on that anecdotal feedback via the AMA, via the Royal Australian College of GPs. I think, people, the fact that there is this indemnity for GPs will mean that they will be much more likely to feel comfortable supporting a patient, that if they do want to make that decision to weigh up the risk, see it's in their benefit and take that risk. GPs will can certainly have a measure of confidence in the fact that they are indemnified. But I think one thing that's sort of one other factor that younger people perhaps should keep in mind is the long lead time between the first dose and the second dose of AstraZeneca. So if you're weighing up, I guess the motivation for a lot of young people is that they just want to get the vaccine now, and that's great. And, such a great thing to be keeping in mind, the safety of the whole community as well as wanting to have the protection for yourself. But I guess if you're looking down the track and saying, okay, well, when am I realistically going to get access to Pfizer? Maybe it'll be, September, October. That, maybe it'll be a bit later than that. But if you get the Pfizer, you've got the 3 weeks until you're fully vaccinated. So you only have to wait 3 weeks for your second shot. Whereas if you get the AstraZeneca, at the moment it's 12 weeks. There is some talk that could be revised down to 8 weeks, but at the moment the recommendation is you get your second shot 12 weeks after the first shot. So I'm not sure that some of these people will end up actually getting fully vaccinated all that much faster than they would if they had waited for Pfizer. But the other big thing to keep in mind when you're weighing up all of these factors is you do get some protection from that first dose. So it's not obviously as high as what you get when you're fully vaccinated, but there is some protection that does come after that first dose. So these are all the things people will be talking to their GPs about, and it's certainly welcome to see that they've got that Medicare schedule item number now, that people can just make that appointment, talk through all of these issues with their GP, because your GP is really the one best placed to give this sort of advice when people are weighing up all the factors in front of them there.
Yeah, I think we'll be hearing more on this from the Health Minister, Greg Hunt, next hour. We're standing by for a news conference with him. Karen Andrews, the Home Affairs Minister, also due to speak to the media. We've heard various premiers over the past couple of days talking about how they want to further limit incoming traveller caps. Some are saying everyone that comes into Australia should be vaccinated. Are you expecting any changes on that front?
Yeah, well, I certainly think it's a sensible recommendation that people coming into the country should be vaccinated. Of course, getting those vaccinations in some countries that you're actually travelling from is easier said than done. I wouldn't have thought that it would be massively easy at the moment, say if you're coming from India to get access to a vaccination. But if you're coming from the US, that would be a very different matter. I think that Gladys Berejiklian did take a principled stand on this when she said yesterday, look, basically it's a human right to come back to your own country. We should not be putting these caps in place because you're blocking people, citizens, from returning. And that's what we need to keep in mind here. Of course, it all comes back to the security of our quarantine programs and our quarantine facilities in terms of those breakouts, because really we wouldn't need to be having this conversation if we weren't having constant leaks from hotel quarantine. So it is quite hard to understand why we don't have that sort of those national facilities that are properly set up. Hotels are not designed to be sites of quarantine. It's no wonder that we're getting these constant breakouts with poor ventilation in hotels, airborne transmission of the virus. But the sooner we can see this quarantine facility established in Victoria, the better. And certainly think it shouldn't be the only one that we're looking to establish.